If you have Medicare Supplement Plan F, stay tuned. Hi, my name is Robert Bache. I own Senior Healthcare Direct, MedicareBob's office. My agents and I, we assist people with their Medicare nationwide. In this video, I'm going to talk about Medicare Supplement Plan F, specifically on why your Medicare Supplement Plan F premium is increasing so much here in 2020, and it's going to continue increasing even more as we go past 2020, 2021, etc. Well, starting January 1st, 2020, there was a new law that passed that nobody that aged in, that turned 65 or joined Medicare past January 1st can purchase the Medicare Supplement Plan F. Well, why does this matter to people that already have Plan F? There's been a lot of misinformation out there. You know, you've heard taglines like Plan F's going away, you can't keep your Plan F, etc. Here's the truth. The truth is, if you have Plan F, you can keep it. In fact, if you joined Medicare before January 1st, 2020, let's say you have a Medicare Advantage plan or a Plan G or Plan N, you can actually still go to a Medicare Supplement Plan F. So Plan F did not go away. Plan F is just not being offered to anyone that is joining Medicare past January 1st, 2020. So how does this impact you if you have Plan F, and what should you do? Well, the reality is, if nobody new could enter into a plan, then the only people that are going to be on that plan are people that are either too sick to leave or people that are getting older and having higher claims statistically. So what do I mean by that? Well, if you are too sick to leave, so why am I saying that? Well, for those of you that are not aware, you do have to medically qualify in order to change your Medicare supplement. So if you have a Plan F and you want to go to a different supplement plan, you'll have to medically qualify. If you have a Plan N or a Plan G and you want to go to a different Medicare supplement plan, you will have to medically qualify. Most carriers ask the same 15 to 20 health questions, and what they're looking for is a 2-year of stability on your health and no chronic conditions such as cancer or emphysema that requires oxygen. My agents and I have a full list of every single carrier and what their health requirements are, so we'll be happy to help you with that. But if you have a Plan F, the people that are going to stay on the Plan F are the people that are too sick to leave, which means those people are also filing claims, which if they're filing claims, that's going to drive up the cost of the Medicare Supplement Plan F. Now, the other people that are going to keep Plan F are the people that are older and statistically have a higher amount of claims. So the people that are going to be on Plan F are the people that are too sick to leave, and the older people who don't know any better and are just staying on the Plan F, but they're older, and as they go to file more claims, that's also going to drive up the cost. See, there are a couple other things that you may not understand about Plan F is it's been the guaranteed issue plan for the last at least 10 years. So what does that mean? Well, guaranteed issue means people could have joined the Plan F if they had a special circumstance for why they lost coverage. So if they had a Medicare Advantage plan and the Advantage plan got discontinued, then they were automatically approved to join a Plan F no matter what their health is. If they have a group insurance plan, like a retirement plan, and then that retirement plan, as we saw a few years ago, we saw this with a lot of big companies, they did away with their retirement insurance and they took everybody and gave them money to go on to Medicare. Well, those people did not have to medically qualify to join the Plan F. So the Plan F over the last 10, 15 years has not been able to be as selective as some of the other supplement plans. It's been required to accept people that might be sick and having higher claims, therefore driving up the cost. So we talked about the people who are too sick to leave, older population that's going to keep the Plan F, the guaranteed issue rights. So Plan F's been the guaranteed issue plan for the last 10, 15 years. So that's another reason why the premiums are higher. Another reason that Plan F's premiums increasing, and it's going to continue increasing, is we've seen the Part B deductible increase over the past few years and some other deductibles increase. But with some of the alternatives, supplements that do not cover the Part B deductible, the Plan F does. So because the Plan F pays the Part B deductible, it's going to be another claim that has to pay. So let me give you an example. If the Part B deductible increases just by $10 a year, well, if you have 1 million people and you're a carrier, you have 1 million people that have the Plan F, compared to like a Plan G or N that doesn't pay that deductible. The cost to insure those Plan F people compared to the G and N just went up by $10 million. because now they've got to pay $10 more for 1 million people. That's $10 billion. Well, the carrier is not going to pay for that, so they're going to increase the people's premiums that have Plan F. So we talked about the Part B deductible, the guaranteed issue rights, this and that. Something, again, it's not that Plan F's going away, okay? You can keep Plan F. And again, if you went on Medicare before January 1st, you can even go to a Plan F if it, for some reason, looks like it's more cost effective, which it isn't. But you could go to the Plan F. One of the reasons, and I've been saying this since 2015, when this law passed that ended first dollar coverage, which is why Plan F and Plan C are no longer offered to people that joined Medicare past January 1st, 2020. Another reason is if nobody new can enter the plan, then again, the only people on the plan are the people that are older or too sick to leave. See, you know, statistically speaking, a 65, 66, 67-year-old doesn't have the claims of a 81, 82, and 83-year-old. So the way the carriers can keep their rates, you know, affordable, and again, we could debate if they're even affordable now. Insurance is expensive, but you know, one way that they can do that is they know, okay, well, as our block of business is getting older, at least we're adding in new people that aren't going to be using the plan as much. Well, if you, with Plan F, that scenario no longer exists. You can't join that plan, again, if you turn 65 in 2020 or past this. So to put that in perspective, in just 10 years from now, the youngest person that can have a Plan F is going to be 75 years old. So again, comparing claim history, a 75-year-old has higher claim history statistically. There's always exceptions to the rule, but statistically, a 75-year-old has higher claim history than a 66-year-old or a 65-year-old. So, you know, we're going to see the carriers adjusting for that. So what can you do about it? Well, if you have Plan F, again, this is not a scare tactic, you can keep it, okay? But you are going to see those double-digit rate increases like we have seen with a lot of the carriers this year, and I think that's only going to continue. That's why I'm making this video, and I've been talking about this since 2015. You can keep it, you know, if you wanted to, but what I would recommend is looking at just going to a Plan G or a Plan N. So, you know, why am I recommending that? Well, I like G better than N. We've seen single-digit rate increases over the past same time period as we're seeing with F. The only difference between F and G is G doesn't pay the Part B deductible. So Plan F pays that Part B deductible, the Plan G doesn't, which is under $200 for the year. So it's essentially the same exact coverage. So you're going to save $50 or $60 a month in premium, and all you have to do is pay a small $200 annual deductible. So you're going to come out way ahead. And again, it's not like you're giving up Cadillac coverage and going to crappy coverage. You're still Cadillac full coverage. Another alternative is going to Plan N, which has 4 out-of-pocket costs, the Part B deductible, a doctor copay, an ER copay, and Part B excess charges. But if you love the Plan F and having the flexibility to go to any doctor, any hospital, and you love having the hospital bills paid in the 20%, a very easy transition is going from F to G. You're going to save money, pay that small deductible, and essentially have the same coverage. So if you'd like some help, want to learn more about what's going on with Plan F, you'd like to look at your alternatives, my office is happy to help you. Senior Healthcare Direct, MedicareBob's office. We have over 100,000 followers on Facebook, over 24,000 customers. We've been open for just about 10 years, and we do a really good job. We can help you now, and we'll help you shop your plan every single year, so we keep you in the know. And we also help you with your Part D drug plan, and we have dental, vision, hearing, and some other options as well. Basically, we're your Medicare place. So our slogan is Medicare done right. So if you'd like your Medicare done right, I'll drop our phone number in the video and a link to our website in the description, and we'll be happy to help you.